All right, I'd like to call the meeting to order. Heather, if you'll do the roll call for us.
Director Harris?
Here.
Director Brewer?
Here.
Director Minor? Here. Director Hart is absent. Director Roberts?
Here.
Assistant Mayor Hollybush?
Here.
And Mayor Brown is absent.
All right, with Director Hart being absent, I'm going to do the invocation. If you'll please stand. And we'll follow that with the Pledge of Allegiance given by our City Clerk, Heather Sawyers. If you'll bow your heads. Lord, thank you for the incredible opportunity to come together and serve the citizens of Texarkana. We pray that you would be with us tonight. We pray that you would give us wisdom to make decisions that are going to be for the betterment of all in the community. And these things we pray. Amen.
Amen. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, with that, we'll move right on into citizen communication time. I've got one card here from Bernice Dickens concerning Nicks Creek. If you'll come up.
Good evening. I'm Bernice Dinkins. I live at 204 East Side Drive, Texarkana, Arkansas, right over the bridge. I'm here about the Nicks Creek issue again. Last time I came, I was with the understanding that the progress would continue to go on each month during the year. Well, I assume that's happening. Now, I went over on East 35th Street. There's some material on that bank down there. I don't know what it is. I'm asking, is that going to be over all the creek or just one area of the creek or what? And then on where I live, right here at the Boys Club, right down here, the cleanup that was done during the summer, all that little digging out and that little edging that they done, well, all the branches and things that they did not take away is right down there on that big old pipe, and it is cluttered up, and if it don't be taken care of, we will be flooded out again on East Side Drive, and that's not going to be too good for us down there. I just want to know what's going on with the progress of the creek, because if that was taken care of properly, that debris would not be on that pipe down there. I went down there today and looked at it again. I started to take pictures, but everybody know where the Boys Club is, I'm sure. It's right across the street. The big old pipe is right over there, and the debris is already lined up. And when it rained this past weekend, where I live, right behind, almost across the street from the Boys Club, that water was extremely high for the creek just to have been dug out. Now, I'm just trying to get some answers here. What is the progress? What's being done? Why is the creek still doing that? That's all I want to know. If I need to call someone personally, I will, or you can call me. I just kind of wonder about that creek. I said, now, this don't make no sense. And I don't know what that stuff is down there on 35th. It's green. It looked like some kind of netting. I don't know if it's to keep the border from deteriorating or what. Is that going to be done just there or everywhere? That's all I want to know. Thank you.
Thank you, Ms. Dickens. We'll have our city manager follow up with you and get you some more information on the progress for Nicks Creek. Is there anybody else who would like to speak during citizen communication time? Yes, if you'll come up here and tell us your name and address.
My name is Shantae Hall, with Shantae Grant Hall. Right now I reside at 2708 Beach Street in Texarkana, Arkansas, which I moved back from Dallas with my son. Well, in Dallas I did door-to-door electricity for 15 years. So coming back home, I understand that now you can put solar panels on your home or your business, which would be a good benefit for the city of Texarkana, Arkansas, as well as Texas. The residents can get a discount, 2 in Arkansas, 1 in Texas. And that'd be a plus because they then become their own energy company. So becoming your own energy company, the company that they're getting energy from now would have to pay them for the electricity that they provide to the grid. So with the grid being compromised in the state of Texas back in 2021 in Dallas, over 1,000 people may have lost their lives. Some lost their lives, and some people were hospitalized because they almost froze. And I know a couple of years back there was a big freeze in Texarkana. And I'd hate to see the same thing happening to our grid here. So I'm determined to make sure that people within our community can take advantage of the solar program that the government is providing. And the government is also giving tax credits towards those that do. So that's what I'm here to say, and that's why I'm speaking today. I hope y'all do consider putting solar panels on your building as well.
Thank you for that. We'll look into it.
All right, thank you.
Is there anyone else who would like to speak? All right, with that, we'll close out citizen communication time and move on to our presentations. We've got a presentation from LifeNet by David Baumgartner.
Good evening, everybody. My name's David Baumgartner. I'm the CEO with LifeNet. We're going to talk a little bit about our annual report. And if you want to go a couple slides, we'll just go right to the little bit about it. First, just as a reminder to the group that LifeNet is an Arkansas not-for-profit. We were formed in 1995, kind of a joint project between, at the time, St. Michael's Hospital and Wadley Regional Medical Center. We started out with 9 board members, and we now have 15, of which 3 are back here. Christy Hickerson and Buddy Allen and Clay Roberts. And then we're lucky enough to have Dr. Matt Young as our medical director. And then lucky for me here today is Weston Davis, who's kind of like my number 2 guy for our area here in Texarkana. He recently just started with us back in November, so he's still kind of learning the part of that. There's a couple things about being a not-for-profit that we like, that some people always kind of need to remember, and one of them is that, we're all about returning whatever we make above paying the bills back into our mission. And no one's getting, bonuses or shareholders or stockholder credits. And the misnomer is the part about paying taxes. We would love to not have to pay taxes every time we buy vehicles and buy property, et cetera, but we still pay all those taxes as well. And I talked a little bit about our board of directors. We're really lucky. We still have hospital involvement on our board. We have representatives from both St. Michael's and from Wadley. And several years ago, what I really enjoyed about it was several years ago, the hospitals allowed us to expand that group from just being people appointed by the hospitals to more of a community-based service. And that allowed us to add people like Dennis Young, who's our newest board member, and Prissy and Buddy and Clay, and over the years, people like Shelby Brown, Pat Evans, that represent not only this side of town, but also the other side of town as well. So if we go on to the next slide, one of the things we're super proud about is that we're accredited. We're accredited by the Commission on Accreditation of Ambulance Services. We're one of probably about 140 in the United States that are accredited. We just went through our last renewal cycle, literally in January. We've been accredited by this group since 2001. One of the reasons I think it's important that we do this, it's a voluntary process. They come in, do an on-site inspection. I don't want to insult the hospital folks. I kind of describe it like Joint Commission, but it's not quite as tough as Joint Commission. But what it is it's the opposite of a financial audit. We all go through a financial audit. We just went through one, had no significant findings. We'll pass that along to Jay as a part of our agreement. But this is an operational audit. They come in, they look at all our policies, they go through our personnel files, they look at our vehicles. Are we meeting all the licensing requirements for the state? Are we really doing quality improvement? Are we really doing what we say about reviewing charts and making sure that our paramedics are doing the right protocols and practicing the right part of patient care? And that's the wonderful thing about that. So we go through that process every 3 years. And they come again on site and go through that as well. So again, we're really proud of that. Being one of only a handful in the country, I think there's only 4 in Arkansas, and we were the first. Although there's some debate about the guy in Pine Bluff, but he's not in business anymore, so I still think we're the first. So we have gone through a lot of good improvements this last year, even with the pandemic, which we're going to talk pretty heavily about. Mr. Ellington gave me a couple of things that he really wanted me to pass along. One is that we completely redid our comm center. If you had gone to our building, our comm center was probably the size of maybe this half of the boardroom. We basically made it about this big. We're dispatching not only for here, but also for several other communities. We've gotten so sophisticated at it. Dr. Young's the medical director for that as well. We provide emergency medical dispatch. What that means for you guys is that anytime someone calls us, we're giving them pre-arrival instructions. It's called the zero response time. So we're giving instructions to the person how to take care of themselves until the paramedics arrive or until the first responders arrive. It's all computer. Every unit has GPS on it. We know where they all are all the time. We can dispatch them at any minute. We theoretically know who the closest trucks are based on some mathematical models that are inside all of that software. So we're pretty proud of it. If you ever come, we're really happy that Mr. Ellington came over and walked through it with us a couple of months ago. If you'd like to come over and see it, we'd love to show it off. It's a great piece of really good investment. Well over, if you all know about communications equipment, it's well over $1 million worth of equipment investment, and probably more than half of it was just on software. The other two,
How many dispatchers is that?
we're running about, we have the full-time staff's about 28. We're running 6 pretty much all the time, 24/7. Yeah, and there's a lead and a lead over the lead. So there's a lot of good coverage there. And the nice thing about that, sorry for the lead in, thank you, is that because we're doing other communities, we might not have had to have 6 people in there, but since we're doing other communities, it allows us to layer that a bit so that when one's not busy, they can cover for the busier communities. So it's worked out really well for us. The other 2 items are items that we've added. One of them is the video laryngoscope. If you've ever seen an anesthesiologist try to put a tube down your airway, paramedics are allowed to do that. It is can be a very difficult skill, but the technology's now where they can put a camera on the end of that so they can see once they open your mouth up and enter that device in there, so where they can correctly place that tube. You never want to put that tube in the wrong spot, because then you're not giving oxygen. You're putting oxygen in their stomach instead of in their lung, and that's not the best way to do that. The other item is just a really simple device called Pulsera, and it's an app on your phone. And it allows the paramedic to alert the ERs that they're coming, the patient's condition. Are they having a stroke? Are they having a cardiac condition that's going to require the STEMI team, if you've all have heard that term maybe from someone else? And then the hospital can use that information to alert their internal staffs and their internal departments. That was actually a project started by the state of Arkansas, and we're a part of that grant, but at some point we have to pick up the cost of it. Right now they picked up 100% of it, and then next year it's 75, then it'll be 50, and then we'll have to pick up the rest of it. That's a fee. But that was just three of the things that we've done this last year and a half during the pandemic. So whenever you're ready to roll to the next one. We put in, for those that saw the annual report, there's a ton of numbers in there, and I'm not going to go through every one of them, but I am going to cover some that I think are important for you guys. One of them is that in our agreement, the expectation is that if someone calls 911 and it's an emergency call, that we're going to arrive within 8 minutes and 59 seconds. We try to do that 90% of the time. And up until the pandemic, we were really doing really well. We did not do that during the pandemic. We were right around 83%. The offset to that, in those 5,799 runs that we went on, the good side of that was even with all that, we still had a 94% patient satisfaction on our independent surveys. We do an independent customer survey on everyone. We were at 94.12, I think, which we felt was normally, if you're doing really bad in one, you would see it in the survey, so we were really happy with that. And we also had, when you go through the big report, you'll find one of the categories is likelihood of recommending the service. That was rated at 93.13. So we were pretty proud of that. And then there's one other question in the survey, was the service worth the fees? And we were just right at 90.1. So all above 90% for us, 90 rating, we're very happy about it. Our PR department kind of got locked down, just like everyone else's did, so we didn't do as many PR events as we have done in the past. The other item that we're going to go in a little more detail with is sudden cardiac arrest survival rate. And so with that, I think maybe if we go to the next slide, it'll, I think, help us get there. For us, one of the reasons that you have an ambulance service is for the patients who suffer sudden cardiac arrest outside of the hospital. That's why we're here. That's why first response, fire department, that's what we're all kind of gearing towards, trying to be able to resuscitate that patient when they had that sudden cardiac arrest event outside the hospital. So this last year, there were 123 people who had a sudden cardiac arrest event inside the city during the calendar period that were reported on. Not all patients, we do not try to resuscitate all patients. Some patients, once they have their sudden cardiac arrest event, quite frankly, are not resuscitatable. So we ended up trying to attempt to resuscitate 51. The reason that you don't resuscitate everyone is that there's two types of cardiac rhythms that you're going to run into. There's the one you see on TV, the squiggly line. That's the good one. That's the one you want, because that's the one you can, with electricity, you can stop it and allow the heart to restart itself. So that's why that's why the first responders have AEDs, and that's why this building has an AED. That's why we have cardiac monitors with defibrillators. That's what we're after. The other type of the patient is the patient flatline, for lack of a better term. There's no electricity. There's nothing to start or refit. They're very, very, like less than 1% chance of survival. So many times the effort is not made on those people. So we were at 51. We had 11 that survived all the way to discharge. That's our primary goal. We really want to get them where they have spontaneous circulation, a return of spontaneous circulation. But that's just one part of it. We really want them to get up and be able to walk home after all of it. So that was 17% of our total patients. We talk a lot about, I'm going to talk a little bit about response times, and we focus on that, but really this is what we're at. This is healthcare. It's not, we're not delivering, we're not Uber, as it were. We're really trying to provide healthcare, quality healthcare outside of the hospital in a timely manner. So this is an important metric for us to be able to do that. One of several quality patient care metrics that we try to focus on. So our survey results, again, I'd said that we do an independent survey, goes to everyone. We don't pick and choose. It's all the data is downloaded every month, sent to a company in Michigan who does it for us. They then compile it and send all the data back. We have some great comments. They have the questions in a five groups. And so our dispatch section scored 93.65, and what they're asking is, was the call answered promptly? Did the call taker give you pre-arrival instructions? Were they clear? So that's for us, we want to be above 90 all the time. The ambulance questions are pretty generic in that they talk about, was the truck clean? Was the comfort of the ride good? Things like that. Still 92%. We focus with the paramedics on the crew rating. That's about 15 questions just about how the paramedic treated the patient. Were you offered pain medication? Did it help? Did they involve you in how the patient was in your clinical plan? Really good set of questions, and really that's the highest score you want of the 5, and we were at 94.12. The business office, how was your bill being treated? Was your insurance being handled correctly? 91.52, and then overall we were at 92%, and that's just for the city. So again, we're pretty proud of the work, considering all the other things that are going on in the background with the pandemic, related to the pandemic. So just a couple things about the ambulance contract between LifeNet and the city that I think it's always good to remind ourselves of. One of them is that it requires that every unit that responds to a call have a paramedic on it. I'm going to talk a little bit about these. These were kind of all lead-ins, but that's been the standard since 1995. that we try to get to every emergency within 8 minutes and 59 seconds, 90% of the time. And very importantly, that we go to every call, every 911 call, irregardless of the patient's ability to pay. People will sometimes say, well, LifeNet has exclusivity, we really don't have a choice. Well, or they have a monopoly, and they really don't have we don't really have a choice. And I would argue that if we had a monopoly, we probably wouldn't go to probably about half of our calls, because we know that those patients are just not going to be, they're going to be underinsured or the like, and not have the ability to pay their bill. We are regulated. You guys approve our rates. There are some parts in there that allow us to raise them based on the CPI, but all our rates are regulated by you guys as directors, and we get no subsidy. So we're doing it all off a fee for service. So if we run, we're all about having a lot of patients to make the bottom line work. So with that, I'm going to go into some things that are going on in our industry. So since March, we've all been kind of in this public health emergency, and I'm sure you've heard more than one speaker come up here and talk about it. For us, I kind of like this picture. It's a little over the top, but I really thought it kind of hit home. We're the burning building. Everybody in healthcare. It's not just us. It's the two hospitals here in town. It's at times Dr. Young's facility. It's all of us. And there's a lot of normalcy going on. A year and a half ago, I probably couldn't have come in here without all of us being in a mask and practicing social distancing, et cetera. And I think that's great. We're starting to be normal again, but really, this fire is still going. And it's as bad today as it was a year ago and maybe 2 years ago. So for us, the challenges have been staffing vacancies, what's going on with our workforce, trying to, not only are they leaving, that there's all the schools were shut down for a year and a half, so we had no new paramedics coming out, no new EMTs while they were in quarantine. We have more use of us. We have an issue now of inflation, and we have bed availability. So I'm going to try to cover each one of them fairly quickly, if you want to flip for me. Perfect. So what's going on with the workforce? The EMS workforce is leaving EMS. This is a study that the state of Arkansas did. That workforce is working at, of all the people that are certified as paramedics and EMT, only 42% of them are now actually working as an EMT or a paramedic right now. So half of the workforce has left the market. They're not even, many of them aren't even working, or they've gone to something that's non-EMS, non-fire, non-public. They're going to places like Dr. Young's, or they're going to the hospital, or they're going to a plasma center where they're not out in the vehicle, out in the environment. They're not doing that. And many of them, some of them are working out of state. It's a great time to be a paramedic. You can be a mercenary paramedic and go work for a contracting agency and go to New York or go to South Texas and make 3-4 times what they'd make for working for a company. That's the last part. You can become what we call a travel medic. And just like the travel nurses, it's all the same. And they literally get probably requests every day to go do that. We've lost one to that, maybe two, company-wide. Two, we've been actually fairly lucky, but that's what's going on with the staffing part of it. And so I talked a little bit about the colleges. I'm going to talk a little bit about UACCH for a moment. So they just started their paramedic program, and we have paramedics in there that have scholarships, and we help them go to paramedic school. But they could have, I think they have 6 maybe, trying to think, out of 20. They could have had 20, but only 6 decided to go to school. And the same thing is going on at the other college, where they could have easily taught 20 people, but they have 5. And they almost didn't make their paramedic program, and we had to help them to get there. So people are just not going there right now. That's a problem. They're trying to, one of the things that we are trying to do, quite frankly, is we're helping both colleges through tuition reimbursement to put people through paramedic school. We did what we call a 5-day-a-week class, an accelerated medic class in partnership with the Texarkana College that we did 2 times where we just literally took an EMT off a truck and put him in school 5 days a week for 5 months, and that got us 10. Now we stopped that program. It was really, when you're paying all that, it really got to be really costly to do that. Now between UACCH backup and TC backup, doing 2 classes, and UACCH doing 1 class, we'll, at some point, 9 months down the road, we'll start to see that flow start again. But we're having a hard time just getting people wanting to become an EMT. And I say, if you've got someone at home, a high school senior, a freshman in college, and they're just a little bit confused about what they may want to do, they should think about becoming an EMT. You become an EMT in 90 days, 1 semester of college. It counts as a biology if you want to go that route. And then they can go work for us and get a salary, health care, medical, dental, pension, all that, and we'll pay for him to go to college. So while he's figuring out what he wants to do, I'm kind of the poster child of that. He may find out that he does that. And then he can go from us over into nursing, which a lot of them do. I would say probably half the nurses that you run into at St. Michael's and Wadley are former LifeNet employees. Chief, how many LifeNet employees do you have?
Off the top of my head, I really couldn't tell you, but it's quite a few.
Yeah, so the chief on the other side, guess what? LifeNet employee. So, or was at one point. So they all, sometimes we're helping them get to that career that they want to be. But we have a lot of them that have been with us the entire time. So again, if you have someone like that, please just send them our way. We're happy to have them write out, talk about that. I think it's a really good job for those younger kids that are just trying to figure out what they want to do. They just don't know what they want to do yet. But they have a heart for the community. They have a heart for service. And they may or may not like health care. So it's a good thing. The other thing that we're seeing is this increased demand for our ambulances. We've really gone through several spikes. If you had called me last April and asked how busy we were, I would tell you that in April of 20, we did nothing. Our volume dropped in half during the quarantine. Then when as we started to see more cases go positive in September of October of 20, we went through the roof. And then we go back down. And then during the summer when we hit Delta, unbelievable how many calls were being called in and how long it was taking us to get the calls through the month of July and August. Then the infusion center shows up, awesome, everything stopped again, and then here comes the next variant, Omicron, and now we're back up, and now it seems to be tailing off again. So for us, we're responding to a lot of these calls, and what's going on with this is that a lot of them aren't wanting to be transported. So we only receive funding if the patient is transported. There's no other way around that. But what happens to us is that we become, as the system becomes more stressed, people start calling us for things that are not ambulance contract related. And I always use this example of the patient who calls, and we end up over there, they call 911, they're transferred over to us by a BIC, by State Information Center to us, and we end up responding, and what happens is that the patient really wanted us to make them a sandwich. And she'll call back again tomorrow, and she may call back again the day after tomorrow. So now we've taken a paramedic and an EMT, rushed them across town, lights and sirens, because she knows the code word, difficulty breathing, or my heart might be hurting. Those are an EMD, that means that's maximum response. Chief Fletcher may be going with us. I don't know. We're all going. If Chief Bennett was here, I'd pick on her. We're all going, and it's literally for something like that. And so now we've put all these resources into this, and she really had never really wanted to. It just becomes frustrating. And I understand why we get it, because it might be something medical at the end of the day, but it just becomes overload for everywhere. We're so busy, and we got all these other issues, and now we got to go make a sandwich. And I know it seems like a crazy example, but I'm sure my guys back here are all nodding their head because they've been on that call. There are people who want to use, that think we're home health. And so they want us to come out. I was in the bathroom. And now I can't get from the bathroom back to the bed. I understand that's going to happen, but maybe once in your life, not every day in your life. And so we're spending all this resources without any offsetting revenue. So what we end up doing is just, changing our rates in a way that the person who gets transported probably paying $1 more than they really should have, because we're trying to do this goodwill work for the other folks. So it's very frustrating for the crews. They don't like it either. They want to be there for the patient who's really sick. They're not, don't take it the wrong way. They're doing the very best they can. They're wonderful sandwich makers, but it's not really what they're trained. They didn't go to school for that. If they wanted to be culinary specialists, they would have gone to a different school. But that's a real problem for us. And then in the meantime, while we're doing that, there's someone who really needs us. And now we have a delay, and it might frustrates Chief Fletcher, because he's got a crew tied up waiting for us to come across town in order to do that, because we're doing something that we really isn't in part of the ambulance contract. So then we have this other little problem creeping up on us, because remember I said earlier, we have rate regulation, right? So we can't go, we're not the dollar store. We can't go back and say, well, we got to sell toothpaste for $1.50 now in order to make up the fact that someone's made a decision that affects us. We're stuck at this one rate for a year, and this one mileage rate for a year. So, right now we're going through a huge inflation thing. Fuel has gone up. The employees, we just gave all the employees back in October a COLA, which was half of this. And of course, they were thankful for it, but, there's just so much you can do. I think the other thing that I would say to the group is that not every dollar billed is a dollar earned. It's healthcare, so it's more like every dollar billed, it might be 20 cents that the patient might actually pay later. So even though you see a bill like that their base rate is $800. We're probably only collecting maybe half of that to a third of that. I think people get that in their head that goes on. And so what happens is you end up, where do you start cutting corners? Maybe you don't buy a piece of equipment, maybe you don't change their hourly rate, things like that, and then the whole group starts to affect. So that's one of the great things about inflation. And then the biggest thing that's probably hurting us this entire time is what's going on with the two hospitals. And they have, between the periods of being overloaded, this picture's in Hot Springs. But what happens is that what used to take us 20 minutes to do now is taking us well over an hour to do. So we would take a patient in, we would hand them off to the nurse would take charge of that patient, they'd go to a room, whether it be, and it happens at both places, St. Michael's and Wadley. Now that's taking us 45 minutes, an hour, sometimes even longer. We chart it every day. We've seen we call it bed availability, some people call it wall time. We've seen it go as long as 3 hours. We've seen it go as long as 4 hours before they'll take control of a patient. And it's just because there's no staffed bed inside the facility for that patient to go to. Because they have their own. If I could probably scrub this slideshow and put any hospital in and do the same exact speech. They have their own staffing issues. So they don't have all the nurses that they would normally have down in the ER or in the ICU or on the floor. And so they're using strike teams, which we had a strike team for a while, but we don't now and haven't had one probably for 2 years. So it's a real problem. And so what happens is now the unit's tied up, so it can't go to the peanut butter call and it can't go to Chief Fletcher's call because it's tied up trying to help the hospital get that patient off that bed. So those are our challenges, and they have been, I wish I could tell you they're going to stop, in the next month or the next year. I don't know when they're going to stop. It may be months, years before we'll see that part of the problem, the staffing part of that problem, get better. And once that starts to get better on their end, it will get better on our end, and the drag on the response times will get better, and it'll it'll have an effect all the way through the healthcare system here in Texarkana for sure. I think I have, I talk about, we talk about response times a lot, but really it's more than just about, and I've talked a lot about COVID, but it's more than just that. We're out here doing, STEMI, trauma, stroke care, sudden cardiac. There are other patients in this system that need care, not just people who have the virus. We're just like everybody else. We've got a limited number of resources that we're trying our best to, do the best job that we can with what we have. So I've got Dr. Young here if you got any questions, medical director protocol questions. I have Weston here if you have an operation question. I should tell you, because I don't get to talk much about Chief Fletcher and Rick back there, Rick Pavick. We're lucky that we have a medical advisory committee, and they review. Dr. Young heads that up. They do our protocols. They hear all of our system reports, et cetera, and their job is to look at the clinical part of what goes on. And for years, we've been dragging Rick to those meetings and making him sit through them and report on, the system as a whole. How's the fire department doing on their part of it? How's the hospital's doing it, and how's life doing it? And he's really been, if he's in town, he's awesome. And when he's not in town, we just know he's off doing something DMAT related, which I think is a wonderful thing that you allow him to do as a city. And then, we drag Chief Fletcher's crews all around town. And if Chief Bennett here, I'd say the same thing for her as well. They're awesome. They're all awesome group.
All right, Mr. Baumgart, I have 3 questions.
Okay.
How many trucks do you have in your rotation? And do we serve outside Texarkana, Arkansas? And what's the name of that app that you mentioned earlier?
The outfit.
The app?
Oh, Pulsera is the name of the app. I'm not. I don't think it can be publicly. I don't think.
Gotcha.
I think you have to have a reason to get it. We serve Miller County, Texarkana, Arkansas, Texarkana, Texas, Bowie County. We also have contracts on the Texas side with Cass County, Morris County. I'll do the cities, Atlanta, Dangerfield, and with Red River County. And we've had contract with the city since 1995. And you asked how many units? We have 23 in our inventory. They're all 100% ready to go. We don't do the backup thing. Every truck is ready to go. We could have 20. If I had 23 paramedics, we could have 23 ambulances on duty at any one moment. We normally try to staff during. We do. We're not kind of. I would describe us more like the police department than the fire department, where the fire department, you have kind of this fixed number of stations. It doesn't change during the day. Their mission is a little bit different because they're there to protect your property. So when you go to work, your property stays at home. So that's why you have the fire department's kind of fixed that way. Are you following me?
Yes.
Yeah. Whereas the police, we're more like the police. We're chasing people all day long. When they go to work, we want to have all the units where they're at work, and when they're at home sleeping, we want to have them at home. So we run anywhere from 4 to 8. Sometimes we'll go from 5 to 9, depending on the call by hour demand. We literally track the call by hour demand. And then we're lucky because we're non-jurisdictional. We can cross them. We're constantly doing this game. All the paramedics are dual certified in both states. So we're constantly, people are going one side to the other all the time.
Do you have in-house maintenance or do you outsource your maintenance?
We do in-house maintenance. We have 3 guys, 3 lifts. They're awesome. Do a great job for us.
Good deal.
Yeah, thank you. I think that's the first time I've ever been asked about maintenance.
On the bed availability, are you guys able to take them to any of the emergency centers that we've gotten to?
No. No, we're not. And that's kind of a 2-step process for us. One of them is that the way their models are, they do not accept a Medicare patient, right? They don't want to they don't want someone on Medicare or Medicaid. And so our board, when this first kind of came up, and really in consultation with the 2 ERs, the 2 freestanding ERs, was listen, we need to be able to take that patient where they can get extended care no matter what their financial insurer or payer is. And so we only take them to Wadley or to St. Michael's. And because half of our patients have Medicare, if we were to take them to one of the freestandings, then they're going to end up having to pay for that trip out of pocket, whereas Medicare would have paid for it if they'd gone to St. Michael's. So that's kind of why we just focus on those two. Not that they're both wonderful, by the way. Don't get me wrong. I'm just saying we do it mainly for the patient's financial aspect at the end.
Well, you
Yes,
have
sir.
an excellent board. I know many of them personally, and every one of them are very community oriented.
Oh, yeah. We're really lucky. We were doing a count the other day. We probably have 30 that live inside the city here, inside this city.
Good deal.
Yeah, and a bunch of them live in Miller County. I don't know. I was at another meeting today where we were talking about Falk. A lot of the guys live in Falk and Genoa, and really enjoy living on this side of the line.
Well, I tell you, I don't know what I can say about Dr. Young that hadn't already been said, but he is a true blessing to this community. I mean,
Yeah,
he's fantastic.
he is. He is really lucky to have him.
Well, someday I'd like to view your motor pool and your operations center. Just come take a look and visit.
I'm sorry, you said you would like to come by?
Yes.
Oh, please, all of you, I think it'd be, just let us know. Oh, sorry. Sing up on me like that. Go ahead.
So,
You brought him out.
yeah, that's right. But again, I'm a product of Texarkana, USA.
All right.
And so, this is my home. And as soon as I came back from med school and emergency medicine residency, this is where I chose to raise my family, starting in 1999, and have been involved ever since, been the medical director since 2003. And what I can say is that we work hand in hand. And when I say that, hand in hand with our fire department, our police departments. There's challenging calls, and there's calls that can be life or death. But, we'll work through those and do what we can to either educate each other on the front end or the back end. And then also with our special operations with the police department.
Yes.
And we work hand in hand with them. And so for us, it really is, as LifeNet, to see it progress, and just as David, Mr. Baumgartner said, so one thing we did do is we stopped transporting patients that had a rhythm that was not resuscitatable. And so that's huge, because Chief and Rick Pavitt can tell you, and the other firefighters, that the most vulnerable time that you are is when you're running lights and sirens. So if somebody unfortunately has deceased at the scene, we're probably not going to get them back. But just as David said, you see that squiggly line?
Right.
We know that that is a potential resuscitatable patient, and we're going to do everything we can to make them the possibility of getting them back. And then also, just to mention, we go to a conference called Meeting of the Eagles, Gathering of the Eagles, and it's held almost every year except for during COVID. But what you realize too is that LifeNet, through the human resources, the insurance that our practitioners get and for their retirement, is one of the best ones. And then the education too, and the quality improvement is there. And everybody's short. Everybody is short. Every frontliner, every first responder is short. Okay? We can ask our fire department, our police department, our Miller County Sheriff's Department,
Yes.
and then we can ask every one of our hospitals are short. Because why? Yeah, a lot of what David said. They've either gotten COVID, they've had a patient or family member with COVID, and or they've left actually the profession because they went somewhere else. And so what we have here is still very, very unique in the sense of we give all of our all to each other. But, when you look at those numbers, that's not just happening here. I serve on an EMS board for medical directors in the state of Arkansas that brings all of them together. And Dr. Bledsoe is one of the head honchos in this. And so, we struggle with the same thing. Texarkana's not any different than Fayetteville, Fort Smith, Little Rock, or, you name the larger cities in the state of Arkansas. and we do that. So for us, it's great, and we appreciate the ability to do this. I think, anytime people can put something in your mind that we could look at a different service or somebody could do something different, but they're dealing with the same problems, but maybe not as the professionalism that LifeNet gives.
Outstanding. Thank you.
Yeah, I wish I could tell you it was just a local problem with the staffing vacancies and the bed availability, but all you got to do is go to Google and everybody's got the problem. It's all over. Little Rock has it, Hot Springs has it, Philadelphia, New York, you name it.
Just take me
Thank
to the
you.
funeral home. Just take me on to the funeral home. I'm DNR.
Which one? I just want to be on record. Don't want to put you on record.
And I have a preference.
Sure you do. Thank you again so much for inviting us. It's probably been a couple of years. I think Mr. Bolt was still here last time we came. I think you might have been actually new the last time we came. So again, thank you so much.
Well, we appreciate all you do.
Yeah, thank you.
Thank
And
you.
Very well.
just give me a call. Happy to have you come by, all of you come by and visit the office.
I will.
I was part of one of those groups, and you took us to each of your locations, and
Yeah.
it was,
I think I had 10
Very
minutes ago, I had a card.
inspirational.
I think I took them out, so.
it was excellent.
Well, and then also I can say, as the local health authority for Bowie County, we've worked so well together with Miller County and to make sure that both sides are doing the same. And just as David said, we had the strike team to be able to come in. The hospitals still have strike teams helping them right now to be able to fill those backfilled spots.
On the website.
Did you get some customers?
So you gave him mic time.
Thank you for that, Dr. Young. And thank you, Mr. Baumgartner, for your presentation.
This thing is happening.
I got it.
All right, thank you.
Thank you,
All
sir.
right.
Thank you, Mr. Owen.
I appreciate you guys. With that, we'll move right into our consent agenda. On our consent agenda, we've got approval of the minutes for the regular meeting, February 7th. We've got adoption of resolution authorizing the purchase of 5 2022 Ford hybrid police interceptor vehicles for the Texarkana, Arkansas Police Department. What would be the desire of the board on the consent agenda?
Motion to adopt.
Second. Thank you.
All in favor? Any opposed? All right, the consent agenda passes. All right, we'll move into our regular agenda. We have one item on the regular agenda, adopt an ordinance amending ordinance number 4-2022 and approving the amendment to the interlocal agreement between Miller County for housing municipal prisoners at the Miller County Detention Center. With that, I'll pass that to our city manager.
Mr. Chairman, after we passed our resolution 422 in relationship to the interlocal agreement, the county finally got to their review of that agreement as well, and they made some minor modifications with their council, which was in relationship to some wording that they had asked us to put in place concerning the prosecuting attorney deciding which one of those categories those prisoners would be placed in. Those are the only changes to the primary agreement. I attended the quorum court meeting last week. They passed the resolution or authorized the judge to go forward and sign the interlocal agreement as well with those modifications, and so I decided to bring this back to y'all to make those modifications as well.
Jay, what were those two categories that you mentioned?
It's the categories for the prisoners.
Okay.
Misdemeanor or
The county had a different wording to say the very same thing, what it said. And so that was non-substantive, and if they got them happy with it, I didn't have an objection to it.
All right, roger that. Gotcha.
Okay, any other questions?
I got one or something. On the item 7, it states what it state, emergency medicine and pain care, on that. And what I have, which I gave each one of y'all a copy of this, and, I was gonna, move to amend that, what you have before you, is to use this wording. And I'm just gonna read what the wording is, so it'll be put in the minutes as to what I'm trying to do or say. That on the 7A, it said emergency medicine and pain definition is an onset illness or injury that threatens life or limb or a serious medical need. It is defined as a value health condition that without timely medical intervention and or EMS will cause one, undue and unavoidable excessive pain not controlled by over-the-counter medication. 2, measurable deterioration in function, including organ function. 3, subject the inmate to further unacceptable health risks or is likely to result in deterioration of health status or death if not promptly treated, and 4, substantial risk to public health. And then B is defining what EMF definition is. It's in the emergency medical service, or EMS, that service is a service provided out of the hospital, acute care, and transportation to definite care to a patient or illness to an injury in which the patient believed constitution a medical emergency. Now, I had emailed this to the city attorney and I guess the city manager for their input, and I guess they can tell you what they think of this here. But what I was trying to do is add this, and that's the only thing this doing is describing, giving a definition what emergency medical is, and also pain care. And that's what I'm going to go ahead and put it in the form of a motion to accept the document that I just read up on the 7 of the existing ordinance.
Can I ask a question on that first, lady?
Yeah.
Is this covered under like the jail standards?
Yes, sir, it is covered under the jail standards, and that determination is done by the sheriff and the jailer, the person responsible for when that person enters the system. So
So that's
I don't
done in
know
the
that-
intake process anyway?
It's an intake process that is not in our control, actually, but we have determined which category the prisoners may go in. But again, when it comes to that medical treatment facility, they do have treatment facilities on site, and they do treat some people on site, and then they determine if they take them out of that property or not to be treated.
But what my objective is that, say for someone get arrested on Friday or something, for instance, that he got to go before the judge Tuesday, and then he have an onset illness or injury, and then the guard, he be saying he need to go to the hospital or something, and he may say, hey, I need to go to the hospital or this or that, but technically, and then I'm trying to define what constitutes an emergency and emergency pain care definition. That's all this is trying to do is describe what the definition is, because I don't think it have it in there, and I guess the city attorney look like he want to respond to this, but that's all this is doing, is just trying to give a definition of what it is. So.
I have one question just before
Well, what this got to do is, this can't go nowhere until one of y'all second it and one of y'all add it to the document.
Right.
I make it easy for y'all.
Right, what my
Say it.
question is, are we,
If it don't get a second, it gonna die right here on the floor, right here. And that's the only thing I'm trying to do. I'm trying to amend existing documentation that y'all have before this governing body that y'all gonna vote on. Now, Mr. Attorney, I know you were finna say something.
Well, I don't want to interrupt the director's question.
yes, my question is, are we in an attempt to rewrite the bylaws for EMS at the prison system, or just what format are we looking at doing here before I vote on something? I just want to know.
Okay, this section of the interlocal that Director Harris is talking about talks about emergency medical transport.
All right.
Who's responsible for it and when? If it's an emergency situation, the sheriff's going to get them to the hospital. That's what it says right now. If it's a non-emergency, there are inmates that have regular hospital visits, anywhere from chemotherapy to, dialysis, things like that, diabetes. That's regular. We know when that's going to happen. In those situations, the city does it. It's not an emergency. We don't have to take the sheriff's resources to do it. We use the city's resources to do it. That's the way it's happening now. The amendment, as I understood it, was to limit what is an emergency. Right now, it says an emergency. This is a specific definition of emergency. The duty to the inmate arises under the Constitution and the Eighth Amendment with cruel and unusual punishment. So that's not something that we can modify by contract. What we can modify is who takes them to the doctor, but whether or not they're entitled to go to the doctor is a constitutional question.
Thank you.
Mhm.
And that's going to already be underneath, or the state jail standards has already addressed these anyway.
Well, they're designed, and I'm not as familiar with them, that's what a sheriff does, but they are designed in the Department of Corrections in that sense to meet those constitutional civil rights obligations of the government actor.
All right, do I hear a motion?
Well, I already made the motion when I read
Do I hear a
the thing,
second?
but I didn't get a second. I don't think I was gonna get a second, but like I said, the only thing I was trying to do is define what is emergency medical is and what is pain care by definition, because that's not in this documentation. And I know what the city attorney was talking about, but he was also talking about acute care, which I didn't bring this into factor. I'm only talking about what considered emergency care, and that's basically that was basically my objective in this in the request for this amendment. So,
Is there a second? All right, for this ordinance, it is an ordinance, so it would have to be read 3 times to pass tonight. Do I hear a motion to have the ordinance read?
First reading on abbreviated form, please.
Second.
All right, we have a motion and a second.
Sorry.
City Attorney, if you would read the,
You want to, it needs to vote on the abbreviated portion. Mr. Mayor.
all right, if you'll call the roll, Heather, we'll take that vote.
Director Harris,
I don't think I'm gonna have y'all trying to read this because, yes.
Director Brewer,
Yes.
Director Minor,
Yes.
Director Roberts,
Yes.
Assistant Mayor Hollabush,
Yes.
An ordinance approving an agreement with Miller County for the housing of municipal prisoners, declaring an emergency and for other purposes.
All right, we've had our first reading. Is there a motion to have the ordinance read on its second reading?
Second reading, abbreviated form.
Is there a second?
Second.
Heather, if you'll call the roll.
Harris,
Yes.
Brewer,
Yes.
Minor,
Yes.
Roberts,
Yes.
Hollabush,
Yes.
An ordinance approving an agreement with Miller County for the housing of municipal prisoners, declaring an emergency and for other purposes.
All right, the ordinance has been read twice. Do I hear a motion to have the ordinance read on its third and final reading?
Third and final reading in abbreviated form.
Second.
Heather, if you'll call the roll.
Harris,
Yes.
Brewer,
Yes.
Minor,
Yes.
Roberts,
Yes.
Hollabush,
Yes.
An ordinance approving an agreement with Miller County for the housing of municipal prisoners, declaring an emergency and for other purposes.
All right, the ordinance has been read 3 times. Do I hear a motion for adoption?
Motion to adopt.
Second.
Is there any other questions or anyone who would like to speak to this before we take a vote?
I'm gonna give my last little pitch on reason why I did what I did, which I kind of left out at the first beginning. That the reason what I really, like I said, brought this up, that I left off the incident that we had some people that died up under our care during in our jail, not the Miller County, but at the bi-state. And so, and there was an issue as to whether somebody was going to take that person to the doctor or not, and that was left up to the guard at that time. So, and what I was trying to do is just bring forward the definition of what's considered emergency care, and that's basically what I was trying to do. Maybe this definition may save somebody's life in the future. Maybe it would or wouldn't have. So that basically that was my objective for bringing forward with this. And like I said, it failed by lack of acceptance. So I did what I needed to do. I know, and like I said, I still went on ahead and had the item in the abbreviated form. And like I said, because I wasn't going to try to have you read this all night just because I didn't get what I thought needed to be added to it, but that's whether here and there, I did my part as a board member by bringing up this issue, and thank you for your time.
Thank you for that. Is there anyone else?
I have one brief statement. From my interpretation of what the city attorney said, the obligation was already covered under the Constitution, and the only thing that we will have to add for accountability, who would be the one to take that person. So that's why I didn't move forward on that.
All right, anyone else? All right, do I hear a motion for adoption?
Yes.
We already
Well,
We already-
yep.
waiting on the
All right,
council.
Heather, if you'll call the roll.
Call the roll.
Harris,
Yes.
Brewer,
Yes.
Minor,
Yes.
Roberts,
Yes.
Hollabush,
Yes. All right, the ordinance has passed. There is an emergency clause requested. Do I have a motion to have the emergency clause attached?
Motion to attach emergency clause.
Second.
Heather, if you'll call the roll.
Harris,
Yes.
Really quick, was there a second? I missed it.
there was
There
a
was a
second.
second.
Okay, I'm sorry.
I second it.
Okay, yeah, thanks.
Yeah.
Harris,
Y'all said yes. Yes again.
Brewer,
Yes.
Minor,
Yes.
Roberts,
Yes.
Hollabush,
Yes. All right, the emergency clause passes. So with that, we'll move out of the consent agenda or out of the regular agenda into Board of Directors commentary. Is there anyone from the board that would like to speak?
I got that. This coming Saturday at 10 o'clock downtown, there's going to be a Black History Parade, and this is Black History Month. And that's basically what I got to say. At 10 o'clock, that's all.
Anyone else? All right, I would like to say that we had our ribbon cutting and our grand opening for our new rec center. Ribbon cutting was Thursday and the grand opening was Saturday, and so we had a really great turnout from the community, so it's really exciting to see that center open. So I just want to thank everybody that was involved in that, everybody that came out and showed support. Does anyone else have anything?
No.
All right, with that, we'll move into our city manager's report.
Mr. Mayor, board members, I got a couple items for you. First, I'll be meeting this week with the A&P Commission concerning our partnership in relationship to the Plaza project. So I just want to let you know that we're continuing to talk about the funding, what amount we'll put into that project and what amount the A&P Commission will join with us as well, in which we have 2 board members as part of that group as well. The next thing is I wanted to share with you, we have a joint tour between us and the Texas side folks to tour the Hotel Grimm this week, while it's going on through the end of its construction period. But our fire marshal and fire staff will tour that, as well as some PD folks, and as well as our building inspectors. And so we'll be doing that from both sides with all of those employees at one time, just to make themselves familiar with that facility, since it will be in operation here hopefully in the next 10 to 12 months. You should have received a management report today. That's over from our departments. And of course, you've gotten your continued city manager reports. We did have some pretty good pictures in there from the ribbon cutting this last week as well. So I wanted to make sure, and the success of opening our rec center and putting our best foot forward for the community, I think was well-deserved and well-recognized by our community, by the folks that came and cut the ribbon with us and then came on Saturday to see what was available to them. So you had at your place some January financials as well, and a new calendar with some dates on it, so please replace your calendars that you may have with these. These are the most up-to-date, since we did make a minor change or two on that. And the last thing I have for you tonight is that Director Brewer and Roberts and I need to get out of here as quick as we can. We are in the Citizens Police Academy, and they're out at the range, and they're going to run us through the ringer out there when we get there, I'm pretty sure. So,
Fire department might need to be.
All right, with that, our next meeting is March the 7th, 2022. Is there anything else from anyone? I'd entertain a motion to adjourn.
Motion.
To adjourn.
Second.
Heather, call the roll, please.
Harris,
Yes.
Brewer,
Yes.
Minor,
Yes.
Roberts,
Yes.
Hollabush.
Yes. And with that, we are adjourned.